Currently, liver diseases are rapidly increasing and showing a younger trend. While fatty liver, hepatitis, or cirrhosis used to be the common in middle-aged people or heavy drinkers, I now see patients who are only in their late 20s or early 30s. The causes are not only from alcohol, but also due to work pressure, a diet high in greasy and processed foods, prolonged late nights, drug abuse, or regular exposure to chemicals. The current high-risk groups include men who drink alcohol regularly and sedentary office workers, overweight or obese individuals, people who must take medication long-term or work in a chemical environment, busy women who frequently stay up late and have irregular eating habits. The worrying thing is that most liver diseases progress silently and cause no obvious pain. The majority are only detected at a late stage, making treatment much more difficult and costly. The liver is the most important organ in the body, responsible for filtering out toxins, metabolizing nutrients, and protecting us from hundreds of harmful agents every day. But the dangerous thing is, the liver has no sensory nerves, so when it is damaged, you can barely feel it. That's why the majority of patients only discover the disease when it has reached an advanced stage. There are many causes of a weakened liver, not just alcohol as many people think. Unscientific diet, high in grease and processed foods, hepatitis B and C virus infection, drug abuse, chemical exposure, staying up late, prolonged stress, lack of physical activity, frequent consumption of beer, wine, and other alcoholic beverages. When the liver is overloaded, the body can send out subtle signals such as fatigue, poor appetite, dark skin, yellow eyes, rashes, feeling of internal heat or bloating. If ignored, this condition can lead to hepatitis, cirrhosis, or even liver cancer. To protect your health, especially your liver, I always recommend to my patients, minimize alcohol and tobacco, because these are the two most damaging agents to the liver. Alcohol causes liver cells to become inflamed and undergo fatty degeneration, while tobacco contains many harmful toxins that the liver must filter out. Drinking less is good, but quitting completely will help your liver stay healthy for the long term. Eat plenty of green vegetables and fruits, and drink enough water. Vegetables and fruits provide vitamins, minerals, and antitoxins that help the liver fight free radicals. Water helps the liver filter out toxins more easily. Prioritize types like kale, broccoli, zucchini, apples, oranges, grapefruit, and others. Sleep early and exercise regularly. The liver is most active at night for detoxification and cell regeneration. If you stay up late, the liver will become overloaded. Gentle exercise every day will improve blood circulation, helping the liver work more effectively. Get regular health checkups. This is the only way to truly know the condition of your liver. Don't wait for symptoms to appear before getting checked, because by then it is often too late. You should check your liver function at least once every 6 to 12 months. In addition to adjusting your lifestyle, you can also combine it with safe herbal products that support liver function. The purpose is to reduce the burden on the liver, help it detoxify better, and recover faster, especially for those who are frequently exposed to liver-damaging factors, such as alcohol, contaminated food, chemicals, or long-term medication. For example, I can mention Liver Detoxnic, a product with a formula that combines several ingredients that have been researched for their benefits to the liver. These include silymarin from milk thistle, a well-known active ingredient with strong antioxidant properties that protects liver cell membrane and helps reduce liver enzymes, selenium procumbens, Phyllanthus urania, artichoke, and honeysuckle are traditional medicinal herbs that have a cooling and detoxifying effect, helping to fight hepatitis and improve liver function. L-arginine and L-orthoninine, aspartate, amino acids that help enhance blood circulation, reduce blood ammonia, support liver cell regeneration, and alleviate symptoms of fatigue. Numerous clinical studies have recorded that these ingredients have the ability to support the protection and recovery of damaged liver cells, help the liver detoxify more effectively, and reduce the condition of internal heat, reduce the negative impact of alcohol, greasy foods, and chemicals, improve common symptoms such as fatigue, poor appetite, and indigestion. I have seen many cases where, after a period of combining a healthy lifestyle with liver detoxnic supplements, patients' liver enzyme levels significantly improved, and their fatigue and dark skin also notably decreased. For men, reduces the burden of the liver from alcohol and tobacco, improves conditions like high liver enzymes and fatty liver, increases energy, promotes a clearer mind, and leads to healthier skin. For women, supports hormone regulation, improves skin, reduces acne and dark spots, lessens feelings of internal heat and hot flushes, helps stabilize fat metabolism, and supports weight management. However, I must emphasize that Liver Detoxnic is a health supplement, not a medicine, and it has no effect of replacing medication. For chronic or serious liver disease, patients still need to go to the hospital to be examined by a specialist doctor and treated according to a medical protocol. Liver Detoxnic plays the role of a supportive product. In other words, it acts like an assistant to the liver, helping to reduce the pressure of detoxification, support liver cell recovery, and maintain stable liver function. And most importantly, buy from reputable sources, because in the current market, counterfeit, fake, and low quality goods are very common. Using these products will not only be ineffective, but can also cause more serious liver damage, lead to additional diseases, and waste your money.